Health economics is the branch of economics that's about the resource allocation in the production and consumption of health and healthcare. At SMC, we use a particular type of economic evaluation technique, and that's to allow us to assess the value for money of new treatments. We look at the additional costs of a medicine, the additional benefits of a medicine, compared to what that patient might be receiving as a treatment at the moment. And that allows us to estimate the value for money case of the treatment. It's important to note that when we look at these value for money assessments, we don't just look at the cost of the medicine. We look at what the benefits of that treatment would be to the patient. And the other important thing to note in these assessments that we make, we look not just at the cost of the medicine itself, but also the other resource use around that treatment. So if, for example, the treatment made a patient feel much better and they're not coming into hospital or seeing their GP as much, that would mean we could take into account those savings in other areas of healthcare spend when we do that assessment. The first important concept in economics to talk about is that of scarcity, true for all economics, not just health economics. Scarcity is when we don't have enough of the resources to do all the things we could possibly do with the resources. And that leads us to the second important concept, and that's choice. When we don't have enough resources to do all the things we would want to do, we have to make tough choices on how we deploy those resources to best effect. This is as true for the healthcare system as it is for you and I in our daily lives. So for example, this year I might have to make the decision between replacing my old car or going on holiday. I would have to work out for me what are the important aspects of those choices and what benefits would each of them give to me in making that decision. And that leads us to the third concept I think it's important to touch on, and that's opportunity cost. When health economics and health economists are working out what to do about these tough choices in healthcare, we have to think if we choose to use our resources in one way, we necessarily can't do something else with them. We've made a tough choice. We've given up one of those other alternatives. And that means when we give up those benefits, that's the opportunity cost. So in the example I just gave, if I decide to replace my old car, it means I don't have the benefits available to me of going on that nice relaxing holiday. That's the opportunity cost of me investing in a new car. In the context of the healthcare system, what that means is if we invest in an expensive new medicine for a group of patients, because resources are scarce, tough choices have to be made, and that means some other group of patients might not get a treatment that they would have benefited from. The opportunity cost of that is those benefits that those patients themselves have had to give up because we invested in an alternative treatment for somebody else. Using health economics as part of health technology assessment is important because it helps us make these tough decisions we have to make in hopefully what is seen as being a fair, transparent and consistent way across different sectors of the healthcare system. It allows us to weigh up those tough choices on resource allocation, setting out the choices we're making, what we will not be able to do as a consequence of making a decision to invest in one treatment or another. And hopefully by doing so, it allows us to maximise the benefits we can get for our population